Anyone who reads autism research knows that there are certain groups of people who just don't show up as often in studies. And one of those groups has historically been girls and women. And for that reason, WPS is thrilled to be partnering with Dr. Lindsey Sterling to bring you a ProLearn webinar entitled Unmasking the Lives of Autistic Females. Dr. Sterling is a clinical psychologist, a researcher, and the founder of the Sterling Institute for Autism. She is also the author of the Social Survival Guide for Teens on the Autism Spectrum. With 20 years of clinical and academic experience, she is exactly the brilliant, practical, supportive advocate we wish every kid had. Dr. Sterling, thank you for taking a few minutes today to talk with us about what's coming up in this webinar and what we can all expect. Thanks.
And thank you for such a warm welcome. Happy to be here.
You're welcome. Okay, you have spent a big part of your life researching, identifying, and understanding autism, and spent a lot of your life supporting autistic individuals. Where is this passion coming from? What's your why?
Yeah, I think I've thought a lot about this over the years and been asked this several times because I think when anyone commits to years and years of education and then dedicates their job to something, there's always the question of what drew you to it and then what keeps you in it. And I think for me, it was twofold. There was just the academic curiosity. I've always been really interested in the brain and what's happening under the hood beneath the surface to make people behave the way that they do, with how they develop their personalities, how they interact. And so in college, I was a psychobiology major and just did brain research in different research laboratories and loved it. And then the second piece is more the personal piece. I have someone in my family, grew up with them on the spectrum, was always drawn toward like helping in the special education classrooms and volunteering at different schools and working with children. And when I first learned officially about what autism was, it was sort of the perfect merging of getting to satisfy this intellectual curiosity, but falling in love with these kids who just are who they are without any pretense. And it's so easy to, I think, connect with them and form that rapport. And so it was really just meeting the kids and working with them in person, first in college, is what actually fueled my commitment to it and wanting to keep working at it.
It must be exciting, to have worked in the field so long that you're really seeing some movement in some of the areas like we talked about with the diagnosis, the identification of autism in girls and women. That needle is starting to move a little bit, and we're starting to see more information coming out, more girls and women included in research. It's really an exciting time to be working in this field. So let's talk about that webinar for a second. Why do you think historically it has been so difficult to identify autism in girls and women?
Yeah, well, you brought up something so interesting about moving the needle and seeing that over the years, right? And when I started graduate school in 2003, a lot of people, when they asked what I was going to study, had never heard of autism, which now sounds so strange to have never heard of autism. But that shows you just in the last 20-something years how far the field has come. And at that time, we were still working on early identification of autism in general. And so the fact that women, girls are now on our radar, in some ways it's not surprising. The earliest conceptions of autism, when researchers in the 1940s, so not that long ago, were writing about autism, all of their descriptions were about boys. So our first perceptions, our first ideas about autism was really about picturing this little boy. And that kind of stuck in all of our minds when we read about autism, when we learned about autism and did research. And in fact, when we did research studies, and people who are doing research studies, I think this is changing, we would recruit participants and make sure that the ratio reflected what we thought was accurate in the research, which was 4 males to 1 female. So even all of our research, it's not based on females, it's based on what we know about males. And so the research findings, the assessment measures that were developed, they were developed based on what we thought we knew about boys. And then you add to that our culture, and we watch TV and we see the portrayal of boys and quirky men who, are supposed to reflect autism. And that gets embedded in our understanding of what autism is. It's these quirky males who we see on TV, like Sheldon from The Big Bang Theory, or The Good Doctor. They're very often little professor-like males. On top of that, there are additional cultural influences. So there's a lot of research to show that females, not on the spectrum, but just females in general, especially in our culture and Western culture, are socialized to be social, to nod, to smile, to be affable, friendly. They're not given as much leeway to just be aloof and to check out. They're supposed to be pleasers. There's, again, a lot of research about the formation of gender identity and how that's embedded into us from a young age. And so those qualities are really not congruent with what we look for in autism, right? So being friendly, having nonverbal behaviors like nodding and smiling. But what we've learned over the years is that many females are doing what we call masking or camouflaging. So they're mimicking what they see around them. They're learning what they're supposed to be doing so that they blend in. And so they're not flagged by providers. Even people in their family will say, they always had friends around them, or when they played on the playground, they were near other girls. But when you actually talk to the girls and the women, they'll say, well, yes, I was near them, but I wasn't necessarily connected with them. I always felt like there was sort of a secret language that I wasn't privy to. I just made it look like I was connecting. And so years would go by without people recognizing what was actually going on.
Okay, so given all of that, how do we continue moving in the right direction? What does it take to identify autism in girls and women? How do clinicians get better at this?
Yeah, this is a moving target. We're still working on this because valid assessment measures really haven't been developed and normed on a female population on the spectrum. So this takes clinical experience, it takes good judgment, clinical judgment, but it takes a lot of listening and believing. And I think that that's not always, it should be what we're trained to do as psychologists, but I think as psychologists, we're often trained to observe behavior and collect data from collaterals, which we should still do. But I think when it comes to females, there's this other piece that's so important, and it's listening and believing. And so much of the assessment depends on the person's internal experience of the world. Because if they're masking, if they're camouflaging, and women will tell me this even during the session, that they're trying hard to unmask so that I can really see them, but it's become so habitual for them
Right.
that we have to rely a lot on what they say their experience of the world is.
Right.
It's also really important to get a detailed developmental history in any autism assessment, but especially with a female, because even though some of the symptoms or the challenges might not become more apparent until later in life, when life gets really challenging, work and job gets challenging, socialization becomes more complex. It still doesn't mean that someone just gets autism when they're 20. It might just be that some of the challenges become more apparent. And so we do have to do a developmental history interview to see what that looked like when they were a child. And if their parent isn't around to do that, it doesn't mean they don't get the chance to get an assessment or diagnosis. We find other ways, we interview who we can, we get to know people who they live with, we get as much history as we can. And we do get other perspectives. So sometimes that's a spouse or a partner or a sibling. What's it like to live with this person? What have you noticed when you go out and socialize with them? So I think that all of this is to say that our assessments have to be a bit more flexible than we might be used to. We're used to like a very standardized assessment for autism. I think that with females, we have to be ready to be flexible, to dig a little bit deeper. Sometimes that means doing a longer assessment, to really get to know the person and not just base our impressions on what we see on the surface.
Wow, that is going to be a really comprehensive and interesting assessment to conduct. It's going to be different from person to person, isn't it? It's amazing.
Exactly. And I think that that's such a good point. We often use the word individualizing assessments,
Mhm.
because, in all fairness, people want to know exactly what the assessment will look like and how long it will take. And we try to give the best idea that we can. But because each person is different, we want to make sure that we can individualize it by adding in certain types of measures, by interviewing additional people, by spending more time with the person, because the more time we spend with them, the more likely they are to unmask and to feel comfortable sharing what those experiences are like. It's a really vulnerable process for them to go through.
Right. Amazing. I'm so moved and impressed by the skill and time and dedication it takes to move through that process with somebody. It's incredible. Okay, so let's talk about the good news. Historically, the news maybe not so great. Now it's starting to move a little bit. What are you seeing in research and in your clinical practice that gives you hope for assessing autism in this population moving forward?
I think what we see a lot of times in history is when one person or a small group of people start to notice something, it's popping up all over the place, right?
Right,
So,
right.
so I'm noticing this, my group is noticing this, but so are my colleagues, and so are people all over the world. So the fact that we're getting more comfortable noticing and describing what autism in females looks like, we're getting a better understanding of what that looks like, both through research and through clinical experience. So we have a better sense more and more of what to look for, and what sets females apart so that we can really incorporate that into our assessment. So we're not all the way there yet, but I feel like people are starting to embrace that diversity, right? That autism in women looks different than it does in autism in men. And we can't just go by the straight cutoff scores that we might have always used in our assessments. But I do think that there's a greater understanding that we need to be flexible. And I'm hearing that from colleagues as well. I think even more exciting is that neurodiverse women are starting to feel more comfortable
Yeah.
speaking up and describing their firsthand experiences and accounts. And there's autobiographies coming out, and there are different websites and forums for people to speak up about what their experiences are. And that's encouraging other women to do the same thing and to actually recognize this in themselves, to be able to connect with the community and say, oh, I actually have been wondering all my life why I have felt differently. And I read this online, and oh my gosh, it resonates so strongly with me. So the fact that people are starting to speak up about their own experiences, we're seeing women self-advocate and come in for the assessments or ask for help. And I think that there's less shame around that,
Right.
once they realize that, oh, there's a community out there who understands me. And the neurodiversity movement, this appreciation of diverse brains and differences, I think is starting to get some momentum so that
Mm.
there is less stigma around a diagnosis and people are feeling more positive about being able to identify with that community.
That's a lot of good news. That's really great news. So what do you want people to be able to take away from this webinar?
I hope that they have an appreciation of the female presentation and that they're open to being flexible in their assessment. So I hope, in being able to go through the presentation and hear about the different female manifestations of autism and what that looks like, and how flexible and open we have to be in our assessments.
Mhm.
I think one thing that comes up in the presentation is biases, right? So I talked a little bit about cultural biases where we expect autism to look a certain way. I think as clinicians, we also have to check our own biases and our assumptions about autism, our experience with autism, and hopefully this presentation kind of reminds people of all of the different ways that autism can present, especially in females. Um, I hope that they know what to look for in assessment. So I'll go through some of the points, some of the tips for making sure that we do thorough, comprehensive assessments with females. And then one thing that I do talk about in the presentation is about a strength-based approach. So I hope that that's something that they come away with when it comes to doing the assessment, providing diagnostic feedback, writing the report, so that the assessment isn't about finding out what's wrong with someone. It's about validating their experiences, recognizing what's different, and also empowering women so that they actually are able to really feel proud of their differences while still validating and acknowledging the things that are hard and providing some direction for that as well.
How wonderful. Dr. Lindsey Sterling, thank you for taking time today to talk about this webinar and what we can all expect. It sounds like it's going to be eye-opening and uplifting, and I'm so thankful that you and WPS are partnering to bring it to clinicians and educators and even some families out there. Thank you.
Thank you so much.
You're welcome.